Following an unexplained cardiac arrest, patients undergo clinical genetic testing to try to identify its cause. To assess the significance of the identified variants, clinicians use the Standardized Variant Interpretation Guidelines from the American College of Medical Genetics and the Association of Molecular Pathology. They assign weights to differing categories of evidence supporting either a benign or pathogenic classification, those with conflicting evidence falling in the variant of uncertain significance category. However, there remain inconsistencies in the interpretation of those guidelines. Finally, variants need constant reclassification upon the arising of new evidence, as it can change the interpretation and clinical management of patients and their families. In this study, the authors aim to develop and validate a standardized algorithm to facilitate clinical application of the ACMG-AMP guidelines. Using 131 patients from the CASPR registry that enrolls victims of unexplained cardiac arrest, they developed an algorithm to facilitate reclassification of genetic variants. They applied the algorithm to genetic results from CASPR to assess the rate of variant reclassification over time, and then compared it to 2 commercial laboratories to determine the rate and sources of discordance. Of the 340 variant studies, 12% previously classified as pathogenic, likely pathogenic, or of unknown significance had a clinically significant reclassification, impacting 31% of patients enrolled. Overall, variants of uncertain significance were more likely to be downgraded to benign than upgraded to pathogenic. When compared to commercial labs, 52% of variants had the same classification as with clinicians, and neither labs agreed on 18%. For the guidelines themselves, the population frequency evidence generated discrepancies in 54% of cases. The authors concluded that a periodic review of variant classification is a key component in patients' diagnosis and follow-up. Inconsistent interpretation creates a potential for clinical care gaps. The development of gene and disease-specific guidelines may provide an opportunity to further standardize variant interpretation reporting in the future.